I'm Ahmed Almomani. I'm one of the interventional cardiologists here at UT Health San Antonio, and I'm also a structural heart disease specialist. I came to UT San Antonio because it's a great program and it's a nice city and a great place for families to raise families. So I have my wife and two young daughters, and I thought of San Antonio as a great place to start my career, and this was my first job. Um, the team here is a very collaborative team. Everybody is so collegial, and faculty, mid-level providers, fellows. We're all one big family, one big group, which creates a wonderful work environment. The structure program here at UT Health San Antonio is the first in the city. It started back with the original trials for both TAVRs and mitral clips. Currently, we have 3 to 4 cardiologists involved in terms of interventional cardiology and EP, and also 3 surgeons involved in the program. We do have a dedicated valve clinic or structural heart disease clinic where we see patients in conjunction with the surgeons to kind of give the patients a comprehensive evaluation and expert opinion and deliver the best treatment possible. Our program offers a lot of advanced therapies in structural heart disease, of course, including transcatheter aortic valve replacement or TAVR, transcatheter mitral valve repair or mitral clip. Also, we do a lot of valve-in-valve procedures in aortic, mitral, tricuspid, or pulmonic position. We do some congenital heart disease work, including ASD or PFO closures, VSD closures, and also we have a robust left atrial appendage occlusion program for stroke prevention. That's also in addition to some other procedures that we offer, including paravalvular leaks, closure of paravalvular leaks, and some advanced complicated TAVR or other valve therapies where modifications of a surgical valve is required, whether that's to allow expansion of the implanted transcatheter valve or to prevent complications like coronary obstructions, including basilica procedure or biobasilitic valve fracture procedure. We're hoping for a lot of growth in our program, increasing in number, and we will have more space to work with. We have state-of-the-art Cath Labs that are being built and hopefully open within the next 2 to 3 months. That will allow us to do a lot of advanced imaging and use co-registration between CT and fluoro or echo and fluoro, which will allow us to do those procedures in a more precise way and probably easier than what we do right now. More time efficient, allow us to do more patients in one day, be more efficient, and try to hopefully attract more patients to come out to our program. The program has been part of the partner trial for the Edwards TAVR valve and also the Everest trial for the mitral clip. Also, currently we have trials for diastolic heart failure for septostomy device, including Corvia or V-Wave. We are looking to have much more, trials to start soon. We do also some maybe less related structural heart disease, but an interventional ward like renal denervation trials and some other device trials. Of course, if the fellows stay with us for an interventional year, they get a lot of procedural exposure in hands-on during structural procedures. But also for the general fellows and the imaging fellows, they get a lot of exposures in terms of procedural planning and TEEs and echoes and looking at CT scans. So our general cardiology fellow become experts in evaluation of mitral valve disease and what measurements they need to do for planning a structural procedure or surgical procedures, and they become experts in evaluation of left atrial appendages and size and if they're suitable for closure, and after closure how to assess the suitability of the closure and whether the patient can get off anticoagulation or not. So there's a lot of exposure, whether it's in the Cath Lab, in the Echo Lab, in the clinic, and it enriches the experience of our fellows.